Hi, are you struggling to understand ECGs? Let's learn how to interpret ECGs in a very easy and enjoyable way. If you still have not subscribed to our channel, take a moment to hit the subscribe button and also click on the bell icon to receive notifications regarding future videos as soon as they go live. All right, let's get back to ECGs. First, let's learn what an ECG is. ECG stands for electrocardiogram or electrocardiography. In some countries, it is also called EKG. An ECG is a test that records the heart's electrical activity using electrodes attached to the skin. So, why do we do ECGs? Now, diagnosis of medical conditions mainly rely on a good history and a good examination of the patient. So, the ECG is a tool, it's an investigation that can be used to support or exclude a diagnosis. And in some cases, it also is crucial in the management of the condition as well as acts as a measure of the outcome of treatment. Having said that, you must understand that ECG is only a tool used in diagnosis and management and is not the only or the main means of management. So, when are ECGs useful? Let's look at a few examples. ECGs are used to identify the cause of chest pain, the cause of shortness of breath, to diagnose arrhythmias, to identify electrolyte imbalances, and so on. Now let's look at how to interpret an ECG. Interpreting an ECG essentially means that we are learning pattern recognition, but it is essential to do this correlating the ECG findings with the history and examination of the patient. Before we look at an ECG, we need to understand how the electrical activity of the heart is generated and transmitted. The heart consists of four chambers, two atria and two ventricles. The left atrium receives oxygenated blood from the lungs, whereas the right atrium receives deoxygenated blood from the entire body. This blood is pumped into the left and right ventricles respectively. That means from the left atrium, you get blood flowing through the mitral valve into the left ventricle. Similarly, from the right atrium, the blood flows across the tricuspid valve into the right ventricle. So now you have oxygenated blood in the left ventricle and deoxygenated blood in the right ventricle. The oxygenated blood, which is in the left ventricle, is pumped out through the aorta and it supplies the entire body with oxygenated blood. The right ventricle, which contains the deoxygenated blood, pumps blood out of the heart via the pulmonary trunk into the lungs, where the lungs will remove the carbon dioxide and add oxygen to the blood. So, this is how the blood circulates through the body across the heart. Now, this whole process is coordinated by the electrical activity of the heart, which governs how and when the atria and the ventricles contract. Now, it is also important that the patient remains perfectly relaxed and still when an ECG is being taken. Why? Because the ECG detects electrical activity not only of the cardiac muscles but also of the skeletal muscles. Therefore, it is important to take the ECG when the patient is not moving and is remaining still. So, to understand the process, we need to look at the wiring diagram of the heart. In a normal heart, the first impulse is generated in the sinoatrial or the SA node, which is located in the right atrium. These impulses spread throughout the atrial muscles and results in atrial muscle contraction. This electrical change is known as depolarization. There is a slight delay before the electrical impulse spreads to the ventricles. This is because the impulse next needs to travel to the AV node located in the interatrial septum. Thereafter, the impulse spreads rapidly through conduction tissue called the bundle of His, which next divides into a right bundle and a left bundle. The left bundle further divides into an anterior and posterior branch, and subsequently, the impulse travels through the Purkinje fibers, and this leads to the depolarization of the ventricles. What is sinus rhythm? Now, as we mentioned before, in a normal heart, the first impulse is generated within the SA node. But in some pathologies, the first impulse may be generated in other locations of the heart. The normal heart rhythm that is generated in the SA node is called sinus rhythm. Now that we learned about the electrical activity of the heart, we will learn how to correlate this with the shape of the ECG tracing. The first wave we see on an ECG tracing is the P wave. This corresponds to atrial depolarization. Now, compared to the ventricular muscle, the muscle mass, the atrial muscle mass is much smaller. Therefore, the wave created by atrial depolarization will be much smaller than the waves created by ventricular depolarization. The ventricular depolarization on the ECG corresponds to the QRS complex. And as you can see, when you compare the size of the P wave to the QRS complex, you can see the difference in the size. The P wave is much smaller and the QRS complex is much larger. Next, we have another wave called the T wave. This corresponds to ventricular repolarization, where the ventricular muscles are returning back to their resting electrical state. Now let's dive a little deeper into the tracing. You may have already noticed that there is a gap between the P wave and the QRS complex. This corresponds to the time taken from the impulse to travel from the atria to the ventricles. Now, before we talk more about ECGs, let's learn a little more about the ECG machine and the ECG paper. The ECG tracing is drawn on a paper strip that moves forward at a standard speed of 25 millimeters per second. And when we look closely at the ECG paper, it has standard size squares pre-printed on it. There are large 5 millimeter size squares, which is further subdivided into 25 smaller squares. So the squares on the x-axis corresponds to time. Therefore, on a standard ECG, a large square represents 200 milliseconds or zero point 0.2 seconds. As the paper runs at 25 millimeters per second, it is equal to 5 large squares per second. So per minute, it equals to 5 times 60 equals 300 large squares per minute. We use this principle to calculate the heart rate by looking at an ECG. We calculate the heart rate by looking at the RR interval between two adjacent heartbeats. If the RR interval is equal to one large square, then the heart rate is 300 beats per minute. If the RR interval is equal to two large squares, then the heart rate is 150 beats per minute. So, in essence, how we calculate the rate is by dividing 300 by the number of large squares we get as the RR interval. Next, it is also important to look at the durations taken for the impulse to travel through different parts of the heart. We'll first look at the PR interval. The PR interval is from the beginning of the P wave to the beginning of the QRS complex. This corresponds to the time taken for the impulse to travel from the SA node through the atrial muscles and through the AV node across the bundle of His into the ventricles. The normal PR interval is 0.12 to 0.2 seconds, that is 120 to 200 milliseconds, which is equal to 3 to 5 small squares. If the PR interval is short, that may mean that the atria are depolarized from a location much closer to the AV node, or there is an abnormally fast conduction from the atria to the ventricles. So, on the other hand, if the PR interval is prolonged, we must think of conduction blocks that slows down the speed of the impulse. The duration of the QRS complex shows how fast the impulse travels through the ventricular muscles. Normally, it's 0.12 seconds or 120 milliseconds, which is equal to 3 small squares or less. Any abnormality in the conduction along the path will result in a longer duration for the ventricular muscles to depolarize. And this would appear as a widening of the QRS complex. Next, the squares along the y-axis corresponds to the amplitude of the electrical current. So the larger the current, the taller the wave. In our next video, we will talk more about the 12-lead ECG. If you found this video useful, don't forget to like, share and subscribe to our channel. See you soon.